So one of the most common myths that we hear today, and of course me being from Scotland, and a common myth we hear across Britain is comparing the NHS to that of the American healthcare costs. We hear this all the time. They talk about as if this is some sort of example of capitalism or the free market, when America hasn't seen, a free market healthcare for well over 100 years. And what I'm going to do is I'm going to quickly read out this part of the article and of course explain about it to help you better understand. And this is important to understand because it will give you an insight as to why there are high costs in the American healthcare system. It's actually because of an absence of the free market. So, the myth of free market healthcare, the AMA monopoly. While most people believe that our healthcare industry is comprised of free markets, it is anything but. The industry is completely distorted by government manipulation. To start with, the American Medical Association, AMA, has had a government-granted monopoly on the healthcare system for over 100 years. It has intentionally restricted the number of doctors allowed to practice medicine so as to raise physician incomes artificially. The primary way it does this is by using the coercive power of the state to restrict the number of approved medical schools in operation. After the AMA created its Council on Medical Education in 1904, state medical boards complied with the AMA's recommendation to close down medical schools. So let me go through this paragraph first, because I think this is important to understand. It was a government-granted monopoly on the healthcare system for over 100 years. In other words, you haven't seen a free market in healthcare for well over 100 years. Thanks to the government granting a monopoly to the American Medical Association, these medical schools were closed down. As it quoted saying, it has intentionally restricted the number of doctors allowed to practice medicine. So let me explain that. As it said, so as to raise physician incomes artificially. Why would restricting the number of doctors allowed to practice medicine, raise the costs, or shall I say raise the incomes artificially of the physicians? Well, the simple answer being is supply and demand. Like I explained before, if you stood in the middle of the Sahara Desert with, of course, a bottle of water, it's going to be worth everything to your entire life, because it's all you have to survive upon. There's a scarcity of that water, so you're going to have a high value for it, a high demand for water for your survival. Therefore, there's a higher cost. If you, however, stood in the middle of Scotland, filled with crystal clear rivers, waterfalls, streams, as a result of that, because you've got an abundance of the water, if you stood in the middle of Scotland with the same bottle of water, you're going to have a lower demand for that water, because you can easily pour it out and you can refill your bottle of water. Because you've got a lower demand and there's an abundance, there's a lower cost. This is in relation to supply and demand. It's no different to a government granted monopoly that has intentionally restricted the number of doctors allowed to practice medicine. The fewer doctors there are available, of course, that are allowed to practice medicine, this can raise the incomes because there's a higher demand than for these medical doctors. Because there's a higher demand, their wages are artificially increased as a result of the lack of medical doctors available. Continuing on, it had said the primary way it does this is by using the coercive power of the state to restrict the number of approved medical schools in operations. Of course, because the fewer medical schools available, the fewer medical doctors that are being trained. The costs don't just artificially raise physicians' incomes, this also relates to medical schools. Just like the educational system in the United States. It's expensive because there's fewer places but a higher population and demand for places. We'll get around to where it mentions this later into this article. You know, as it says, after the AMA created its Council on Medical Education in 1904, state medical boards complied with the AMA's recommendation to close down medical schools. So here's where we go on to explain this to help you better understand. Within 3 years, 25 schools had been shut down, and the number of students at remaining schools was reduced by 50%. After 3 more years, 10 more schools were closed. So let me just explain about this first. That meant there was a reduction by 50% fewer, of course, being trained. Fewer medical doctors being trained because there was a closure of 25 medical schools. Essentially, it's going to cost more to go to these medical schools because there's fewer of them and a higher demand for placements. The fewer medical schools, as I say, the fewer medical doctors available there to treat people in need of medical treatment. Continuing on with what it says, after 3 more years, 10 more schools were closed. So you're talking 35 medical schools from 1904 to 1910 closed down. As it says, since that time, the US population has increased by 284%. The population has vastly increased. What does that mean? Because there's a far higher percentage in population, there's going to be a far higher demand for medical treatment. And because there's fewer medical doctors, it's just like if you stood in the middle of the Sahara Desert, the fewer you have of something, just like the one bottle of water, the scarcity means that there's going to be a higher demand for that water and higher cost because there's, less of it. So it's the same thing, it's the same principle. If your population increases by 284% and you have 35 medical schools that were closed down with, a 50%, reduction, you have a higher demand for medical doctors. So not only are the physician incomes artificially driven up because of this, because of the demand and the fewer doctors in supply, you also have the higher cost of medical treatment, and this was granted by the government. So in other words, this was nothing at all to do with the free market. As it says, while the number of medical schools has declined by 26% to 123, the number of medical schools has vastly decreased since that period. As a result of that, as I say, the higher percentage in population means an increase in demand for medical treatment, with fewer medical doctors being available to cope with that larger demand. So there's a higher cost. Continuing on, in 1996, the peak year for applications, only 16,500 candidates were accepted out of 47,000. Because there was a high demand for placements, and because there was only 16,500 places available, due to the high demand but low supply, there was an extremely high cost. And that is the reason why your education is extremely expensive. So, as it says, while high rejection rates can be common in many schools, applicants to medical schools are usually among the brightest and highest quality students and have put themselves through a very costly admissions process. And it's a very costly admissions process because there's an extremely high demand for placements, but there's fewer of the placements available. Let's just say, for argument's sake, you had 100,000 places, but 47,000 applied. The 47,000 people would get in to the medical schools, and there would be a lower cost because, a lower demand for places. So it's not as simple as saying it's private education or private healthcare that's caused this. It's due to government's granted monopoly. Continuing on, it says high rejection rates are why so many aspiring doctors attend medical schools in the Caribbean, where they are prepared to be American doctors. The medical monopoly also marginalises or outlaws alternative or slightly alternative, i.e. competing medical practices, along with nurses and midwives who could perform many of the tasks doctors do today. It's quite important to note that along with the nurses and midwives who could perform many of the tasks doctors do today, what does that mean? It means that if you had these nurses and midwives doing many of those jobs, there'd be more medical doctors available for treatment. Therefore, costs would go down because there's a lower demand for them. So you understand, this has nothing at all to do with the free market. And why? A free market in healthcare basically means that it's a straight transaction between the consumer and the provider. And what I'm going to do is I'm going to explain to you in a video about the NHS in comparison to American healthcare costs. Basically, why it's not a free market in healthcare. It's a straight transaction between consumers and providers. In America today, they don't have that. They've had for over 100 years a healthcare system involving a third-party payer system. So anyway, folks, I hope that's been educational for yourself. Maybe it's been of benefit. If you have any questions, feel free to ask me in the comments section below. Also, if you like the video, share the video, and of course, I shall talk to you later. Thank you for watching. Cheers.